right now.
Go.
Good morning, students and friends. This is Chris Wager with the Central Asian Productivity Research Center, continuing our spring lecture series. I'd like to introduce. Good morning, students and friends. This is Chris Wager with the Central Asian Productivity Research Center, continuing our spring lectures.
Go ahead. Sorry.
Okay, I'd like to introduce Professor John Kalaris, founder of Ariston University, to be our host today. John, take it away.
Thank you, Christopher. Ladies and gentlemen, it is a distinct honor for me to introduce a distinguished colleague and friend of mine, a professor for many, many years with unmatched expertise in the fields of public administration. Our speaker today, when you lose something, you lose it the moment that you don't want. Anyway, I just lost the intro there. Our speaker today has been a professor with the Illinois Institute of Technology, and he has earned his degree in public administration and education. Actually, his degrees are with honors. He also serves in the public arena, in the Lyons Township, and the expertise that he brings to us today are unmatched. Professor, it is indeed an honor for me to introduce you, and we're ready to hear your expertise and wisdom for the day. Please take it.
Thank you so much, John. I certainly appreciate this opportunity to address the students. Let me share the screen with my presentation, and then we will get started. Okay. How does that look to you, John? Does that look like it's appropriate?
You need to move it a little to the right.
Okay.
Yeah, the other way.
Okay. Is that good?
Yeah, the other right. No, the other right.
The other right. Okay. Like that?
No, a little more.
Okay.
You're missing the three letters, the three beginning letters.
Oh boy. Well, let me see what I can do. Okay. Stop share.
I think you're okay now.
You can see it fine?
I think, well, you're not sharing now.
Okay.
But will be. Go back to sharing. There you go. Yes, we can see it beautifully.
Okay, good. All right. I'm not sure what happened the last time, but we're doing fine now. Well, today we're going to cover the pandemic and challenges to productivity. We are in 2 years into the COVID-19 virus pandemic, and it's had significant changes in our workforce, our education system, our healthcare, and really it's impacted businesses and productivity significantly. So I'm going to cover a number of those challenges that not only exist in the workplace, but within families and within communities. Going to first talk about what's been the impact on people's physical health, on their financial well-being, and behavioral issues such as stress and substance abuse. We'll then talk how do those affect businesses, employees, morale, productivity, costs, not just the impact on employees, but the impact, it could be a family member, it could be a child, it could be someone else. It's affected the whole community. And finally, what can we do? What can businesses do, organizations, corporations, to address these challenges and move forward and improve our productivity? First of all, besides the direct medical complications, if someone contracts the COVID-19 virus, what are some of those things that could impact productivity? First of all, there's a lot of physical and behavioral health issues. Just the isolation that many of the people had to experience when businesses had to close, when Cities had to be isolated when there were curfews, when people were not allowed to be in groups or had to have social distancing. It really caused some undesired changes to people's physical health, their weight, their strength, their physical fitness. They weren't able to go and do the types of activities that they were in the past, whether it's gym, whether it's sports, youth and college students and adults weren't able to say go to the local gymnasium or go swimming or do other things. There's been a significant increase in drinking and substance abuse while people were isolated, while they were experiencing a lot of anxiety and fear from the pandemic. One of the things that they could do to try and feel better and relieve some of that stress or panic is to have some drinks or use some drugs to be able to feel better, which might help you feel better in the short term, but has a significant consequences, not just personally, but to the family, to employers, to businesses, and the community overall. There's also a number of other negative behavioral changes that happened because of COVID-19. Many may be related to an inability to cope with prolonged stress. We've gone through 4 waves now of various forms of the COVID-19 virus. And in some cases, we don't know if there'll be another strain. Right now, Europe, China, South America, there are once again isolations, shutdowns, whole cities where there are curfews or people are not allowed to again gather in groups or go to work, and there doesn't seem to be an end in sight. Certainly, we have vaccinations now, which help. We have some medications which help, but there's still a lot of prolonged stress. 61% of the individuals measured in a recent study experienced undesired weight changes, either weight gain or loss, and mostly gain since the pandemic started. 42% reported that they gained more weight than they intended, an average of almost 30 pounds, and 10% said they gained more than 50 pounds. Again, they're isolated. They haven't been able to get out and do the things that they've been able to do in the past to keep themselves in better shape. For 18% of Americans who said that they had lost more weight than they wanted, the average amount of weight lost was 26 pounds. There could be several reasons for this. It could be that they've lost their job. They don't have enough money to be able to afford the food that they were able to eat in the past. Or it could be stress and anxiety has robbed them of their appetite and they're not feeling that they're able to eat. Or it could be other illnesses that have compounded that. Many people have put off seeing the physician, seeing the dentist, seeing the eye doctor or other things because of the pandemic. They don't want that face-to-face contact. Such changes come with significant health risks, including higher vulnerability to serious illnesses, both from the coronavirus if they contract it, or just serious illnesses that mount if you gain weight, if you stop having an active lifestyle, if you become obese, there's diabetes, heart disease, a number of other issues that can raise, and substance abuse. If you're drinking more or coping with stress by using drugs. 2 out of 3 people said they've been sleeping either more or less than desired since the pandemic started. So there's been a lot of sleep disturbances, which also affects physical health. And as I've said before, there's a significant problem with alcohol, with 1 in 4 adults reporting drinking more alcohol to cope with that. And this is the American Psychological Association's Stress in America survey. The pandemic has really taken a toll on parents of children under 18, particularly single parents. But slightly more than 3 in 10 adults report that their health has worsened compared with before the pandemic. Nearly half of the mothers who still have children who are home for remote learning reported that their health worsened. Oftentimes now people are having to work at home and have their children at home with them for remote learning and trying to balance that. Or if they're still going into the office, they're having trouble with childcare because the children aren't able to go to school. 30% of the fathers who still have children at home report the same. Parents were more likely than those without children to receive treatment from a health professional during that time, 3 times as much almost, and to have been diagnosed with a behavioral health disorder since the coronavirus began. More than half the fathers reported gaining weight. Nearly half said that they are drinking more alcohol to cope with stress. One of the things which isolation brings is the fact that you are at home. So therefore, if you have a few drinks, you don't have to worry about driving. You don't have to worry about walking. You are staying at home and you're at home more and more. And there's less and less to do often. Yeah. The impact on essential workers, such as healthcare workers, people who work in law enforcement, people who work in grocery stores and other things where they have to work, pharmacies, it's impacted them even more. The majority of essential workers have relied on a lot of unhealthy habits to get through the pandemic. Nearly 3 in 10 say their health has worsened. 3 in 4 say they could have used more support than they received since the pandemic began. Essential workers are more than twice as likely as adults who are not essential workers to have received treatment from a mental health professional, again, almost 3 times, and have been diagnosed with a disorder since the coronavirus pandemic began. And it's 25% versus 9%. So you've got a lot of pressure, a lot of stress, a lot of unhealthy behaviors because of the demands that are put on, particularly essential workers. Oftentimes they've had to work double shifts. They've had to cover for people who have not been able to come into work because their children have not been able to go to school. There's been a large number of people who are just have either quit or they're not going to work because of fear of the coronavirus. So there's a lot of pressure on our essential workers. Yep. And much of it has to do with stress, anxiety, fear, either they contracting the illness, their loved ones, or people they know, the fear of it spreading throughout their community or their schools or their workplace. Many people are more anxious, depressed, and susceptible to take extreme steps due to various reasons, such as job loss. I know in our area, several businesses closed. Many people were laid off because those businesses were not operating. Losing someone who is close to them to coronavirus. You know, I personally have had 3 friends I know that have passed away from coronavirus. Just the lack of social gatherings, isolation, lack of church and spiritual activities, the lack of sport activities or cultural activities. Doctors have observed an increase in the number of cases during the pandemic where people have tried to attempt suicide. People are afraid of getting the COVID virus, either themselves or someone they know. They're afraid of that contact with other people. Here in my area, they loosened up restrictions on masks. However, many people that are coming into our public building in the township headquarters are still wearing masks, and they're still afraid of contact with people. If people have been isolated or just meeting people for some of the first times, they may be fearful. It could be even someone that they've worked with for a long time or a family member or something else, but they've been isolated during the pandemic. There have been 6.17 million deaths due to COVID worldwide. Just think of how many families, friends, schools, communities, churches, mosques, etc., that are in mourning and fearful of that spreading again. These include your employees, your customers, and the community at large. Yeah. One of the problems also that I had just mentioned, that a loss of job, either themselves or someone in their household, that's impacted them in not only in the isolation and the loss of everything with the job, but the financial situation that they're facing now, the financial crisis. About 3.2 million Americans had told the Census Bureau that they weren't employed because of concerns about the virus. That's up 30% from a previous polling period. The number of people staying out of the job market due to COVID anxiety now exceeds 2.5 million who said they aren't working because their employer closed temporarily due to the pandemic. Many of those people did not go back to work, even if the employer opened up. It's a much smaller workforce now. Maybe there's more social distancing, fewer tables in a restaurant, fewer children in a daycare center. They don't need as many workers as they open up. More than 3.2 million people say they aren't working because they're worried about getting or spreading the virus, an increase of 30% from mid-July. And this seems to be significant in the population as they age. As you see people over 50, over 60, over 70, they're more and more fearful of contracting the virus because the virus is so much worse on the elderly. And all employers in all sectors are finding that it's very hard to fill vacancies. So you have a lot of open job positions, which makes it even harder for those who are working. There's a lot of burnout and financially strapped, particularly single parents are struggling during the pandemic. Women have been hit disproportionately during this crisis. Of the more than 1 million workers over the age of 20 who left the workforce last September, 865,000 of them, and this is in the United States, more women. So almost 90% of them were women. While jobs are being added back, women are still behind in those gains. The organization found that there are fewer women being brought back than there are men. And there are still more than 2 million fewer women in the labor force in October than there were in February. There's a huge problem of people either facing eviction or foreclosure because they've lost their job, because of the financial problems, or they've lost a loved one. I know a family with a disabled boy, and the father passed away from coronavirus last October, and they're facing significant financial problems right now. A new report shows that nearly 10% of landlords across the country collected less than half of the rent in 2020. And landlords who owned smaller units, fewer than 6 units, smaller buildings were most affected. And there's really no housing safety net. The reports of Vincent Rena, a professor at University of Pennsylvania, were forcing low-income households and the owners of those properties to essentially bear the cost of this in the current moment. And it's really unfair to both parties. Homeschooling, e-learning, there's a lot of problems with this. And it's impacting the workforce because those children need to be supervised. Nearly 1.1 million dropped out of the workforce between February 2020 and March to take care of their children. Unemployment was very high for women with children. At the same time, there were almost 1.4 million fewer moms of school-age children actively working than in the prior year. 62% of adults with children said their additional childcare and virtual schooling responsibilities during the pandemic hurt their ability to get ahead at work, according to recent reports. It's very difficult to maintain your advancement in careers if you have to keep taking time off or keep having to deal with a situation with your children or family issues. Parents are feeling left behind in their career and in their workplace. Childcare and preschool admissions were poor before the pandemic began. Oftentimes they didn't exist, or they didn't have sufficient childcare in their area before COVID hit. The pandemic has compounded these challenges. Not only do parents have to be extra selective to ensure their child is safe, but there are fewer and fewer providers. And as I said before, oftentimes they have smaller numbers of children to deal with because of social distancing. They may not have as many workers to manage the children. They aren't accepting the same number of children as they did before. Many of them have just shut down. They cannot afford to continue to operate. And some of them permanently. Their bottom line was so fragile at the time that they weren't able to survive. When COVID first hit, 2 in 5 providers said that they were confident they would have to close down for good without additional funding. Now, there has been some government support, at least in our country, to be able to keep some of them open, but I know a number of childcare centers that have just closed, and those that have opened, they're taking smaller numbers, they're understaffed, the ratios prevent them from serving as many children as before. Wait lists are much larger than they were in the past. Caregivers report adverse health symptoms, and we talked quite a bit about health before. Those who are taking care of others report an increase in both behavioral and physical health symptoms. Although those who had support from others had lower odds of experiencing adverse health symptoms. So those who have a support system, grandparents, friends, other relatives who are able to help, daycare centers, churches, other types of help, had better health than those that are more isolated. Caregivers need to seek social support, access treatment, give themselves a break. Our Center for Disease Control and Prevention recently released a report and stated that 70% of the adults serving as caregivers reported adverse symptoms related to mental health during that. And anxiety and depression were up, as well as traumatic stress disorders and reported suicidal thoughts. Domestic violence is another problem that's increased. If people are isolated at home and there's a potential for domestic violence and an increase in substance abuse and alcoholism, you're going to have an increase in domestic violence, and it's going to be hidden. And overall, these incidents tend to increase during times of stress. It seems especially likely given the contents of the pandemic when more people are experiencing prolonged contact with potential abusers alongside financial stressors. This is occurring as emergency and community resources have been overwhelmed. The number of domestic violence incidents in US increased by 8.1% after the lockdown orders. This is based on a review of 18 US and international studies that compared domestic violence incidents before and after the lockdown. Another issue under domestic violence is child abuse. Most of your child abuse reports are from teachers, ministers, spiritual advisors, people who come in contact with the child outside of the home. And if children have been isolated in the home and have either not been going to school or been going on e-learning, you don't have the same type of monitoring and potential to be able to catch child abuse cases. So there's also a wave of child abuse because those children who are at risk of that are now isolated with the abusers for longer and longer times at a time of high stress, high financial problems, and high substance abuse problems. Early reports relied on domestic violence for police reports, but every form of data showed overwhelming evidence of an increase in domestic violence. It often goes underreported due to shame and fear. It's not always taken seriously by law enforcement. So even with those statistics, it's probably much larger. I talked about lockdowns trapping the survivors with abusers and making it more difficult to report incidents. Stay-at-home orders are the exacerbated factors associated with domestic violence. The increase in unemployment, the lack of childcare, poor coping strategies, and I mentioned alcohol and substance abuse. Finally, there's some statistics I wanted to cover on unhealthy weight, on alcohol and substance abuse, both employees and family members. With unhealthy weight gains, there's an increased drinking reported by Americans. Early in the pandemic, adults in the United States were drinking more alcohol to cope with the stress of it. Almost 2 years later, those early spikes in alcohol remain consistent. Through 2020 and into 2021, I don't have the end of the 2021 reports yet, but they've soared even higher. People didn't just increase their alcohol consumption for a month or two. The trend held for nearly the entire year, even with restaurants and bars closed. In 2020, liquor sales surged 21% in the United States compared to the same month in 2019. About 1 in 18 people with an alcohol issue will actually seek support from service. So we're only seeing the tip of the iceberg. Out of those, 1 in 18 people that have a problem, 17 of them are not being helped. Many of them are your employees or your employees' spouses or relatives, and they impact your businesses and productivity. You may wonder why people don't get help. And one of the big things is just stigma. They don't want people to know that they have a health problem, that they have a financial problem, that they have a substance abuse problem. They have fear of losing their job, friends, family members, just as the shame of that. There's religious stigma, social stigma. They're afraid they won't get maybe a career advancement, a promotion, because people at work have heard that they have health problems. They've got heart problems, they've got diabetes, or someone in their family lost a job. So the friends or relatives or people in the community may not treat them the same. If there's reports of domestic violence or financial problems or just fear, people tend to isolate and shrink away from each other if they're fearful. And they're afraid of the shame on themselves, their family and their business. Somehow they failed. They don't want other people to know there's problems that they have either regarding themselves or someone in their household. If they're not reaching out to get help, the problems will get worse and affect the productivity of workers, customers, and the community. The stress and anxiety this produces directly affects their health and their welfare. So it spirals, it just gets worse and worse and worse. What are some of the things that employers and businesses can do regarding these problems? There are great costs to businesses and employers because of both the problems and the stigma. You have individual medical costs. If the employer is providing insurance, if the employer is providing medical care, if there's a company nurse or a clinic, you're going to see an increase in that. You'll see an increase in absenteeism. So you'll have fewer workers there. That they will not be as healthy. They won't be as productive if they're dealing with obesity, if they're dealing with alcoholism, if they're dealing with domestic violence. And you may see theft, all impacting your productivity. Just the overall stress of the pandemic causes anxiety, causes people to respond differently. The lack of physical activity. As I said, obesity causes lots of health problems. Maybe harder for people to move around, harder for people to do the physical labor that they did in the past because they've been isolated so much. Substance abuse can cause increase in heart disease, obesity, diabetes, accidents, stomach problems, liver disease, many more problems. These increase employer or government healthcare costs. oops. Such a huge increase in health problems will also have an increase in absenteeism, both for employees with health problems and those that have family members experiencing those, because someone may have to take care of the child or the adult or the sibling or the parent who's at home with a health problem. And so you may see more and more absenteeism at a time where people are leaving jobs, people are staying home or quitting jobs, and it's getting very hard to replace people. Employees with severe financial stressors, such as the loss of a job by a spouse, of the cost of a substance abuse habit, may cause them to steal from their employer, either money or goods. They don't have enough food for their family. Maybe their spouse had a job as well and they've lost their job, or they're sick, or someone in their family who was a wage earner has passed away. They may take home some of the food. If they don't have enough money for rent or alcohol, they may steal from both the employer or from coworkers. Some of the highest bills are faced by COVID patients who require extensive hospital care. Many have swamped hospitals and intensive care units, and those are very expensive services. Most of those patients were now unvaccinated. Expenses can range from thousands to millions of dollars, depending on what's required. Some patients have extended stays in intensive care units. They may require lung transplants. A recent Kaiser Family Foundation found that 72% of large health plans in the United States are no longer making COVID-19 treatment free for patients, but are having them pay a portion of that. All of these problems have a negative impact on morale, and studies are showing that employee morale is at its lowest point in years. With this fourth wave of the COVID-19, morale is dropping again due to the fear of that we thought was ending may continue in waves or spikes indefinitely. Many workers have been working from at home or in isolation and don't want to return to the office or go to large group settings. Many workers have quit their jobs in unprecedented numbers. I know many of the agencies that we deal with for healthcare, for mental health, they have many job vacancies open, which make it even harder for them to provide services at the local health clinics and other areas because they have so many vacancies. Many people, if they're eligible to, have chosen to retire, and they're not returning to the workforce. This has caused a great loss in skills and knowledge and history. And you have this generation that is retiring right now that was born after World War II, called the baby boom. And that's not only in the United States, but in Europe and some other areas, those who were born in the from the late 40s to the early 60s. And if they have the opportunity now, they are retiring in great numbers, whereas without the pandemic, they may have still continued working for a few more years. Many employers are having an unprecedented number of job vacancies, and it's getting more and more difficult in hiring. In the United States, there's been a huge increase in salaries just to try and attract more and more workers and keep those that people have so that they're not leaving the workforce. There's had some success in that, but there's still a large number of vacancies. So what can we do as businesses to decrease these costs and increase our productivity? I can't stress the role of communication with your workers and between workers during the COVID-19 pandemic. And it's not just about COVID-19, but all of the aspects regarding the workforce. It's a key part of your effort to build a safe workplace culture where people feel secure, where their anxiety is reduced, where their stress is reduced, where they feel secure in their job. Since COVID-19 remains an issue, this is and seems to keep continuing to spike, it's more urgent than ever. Consider how you are communicating. Ensure your communication plan has the following characteristics. show honesty. Yeah, the moment that your workers sense that you've been less than forthcoming on any issue related to COVID, it's harder to regain their trust then. So if you're going to require vaccinations, if you're going to require masks, or if people are going to work from home, or if they all have to come back into the office, you have to be honest with what you're doing and not surprise people. Let them know the plans ahead of time, give them plenty of time to adjust. How to deal with people coming in from the outside, if it's customers, if it's clients, if it's other things. You have to have very clear and honest communication. Nothing can be ambiguous. It has to be consistent, straightforward, and honest. Have clarity. Everyone needs to understand it. It can't be left up to the interpretation of individual employees or individual managers. If you're going to establish protocol, then everyone needs to follow the protocol, and it has to be equal and fair for everyone. When you set policies or procedures or expectations, you communicate them to everybody in a clear way. They should know exactly what you expect of them, how they should respond in any situation where COVID exposure could be a factor, what to do if they've come in contact with someone with COVID, what to do if they have tested positive themselves, what to do if they find out that people that they've been dealing with or people in meetings have come down with COVID, and what is the policy on vaccinations, masks, and distancing. Whatever those policies are, they need to be clear and communicated easily and easily understood. When you communicate that you have to engage people. There has to be a discussion. They have to have an opportunity to respond, either with questions, with meetings, with discussions, maybe surveys or anonymous surveys or notes or other things, so that if there's any type of concern that people have, it's dealt with. And that way they don't carry that fear with them, and they know what the answers are. Invite employees to ask questions, share their concerns. It may reveal issues to you that you hadn't considered previously, where you may have a response that you hadn't expected, and it might be even easier than what you were planning. But input from employees always helps in a situation like that. Include COVID education throughout your organization, and don't assume that everyone has an accurate understanding of the pandemic, of COVID, of what the policies are, of what the governmental policies are, what COVID can do. There's quite a bit of misinformation out there, particularly all over social media. There's lots of conspiracy theories. There's lots of assumptions or studies that really did not pan out, but people decided to use those treatments anyway, or act as if that was true. And even intelligent people may have adopted some of those. Others may be simply unaware of best practices or protocols that they should be following. And so it's very important that you continue the education, you continue keeping people updated and reminding them of what type of protocols you do have and how they are supposed to act in whatever the given situation may be. As you bring in new workers, think about your onboarding process. How do you orient them? How do you train them? How do you cover the pandemic education in those things, and the type of support that you may be giving employees during the pandemic? And consider making information about COVID-19 available to all members of your team. It should include educating new employees about your COVID-19 policies. Creating a supportive work culture during COVID-19. You've got a population, a community, a world that has really been stressed by this pandemic. And when you think about workplace safety and COVID-19, you may be focusing solely on COVID-19 transmission risk, it's certainly important, but you may be missing out on other opportunities to create a positive work culture in the face of COVID-19. Think of the problems that we just covered in this presentation, the health problems that people are experiencing, the anxiety, the stigma, substance abuse, isolation, dealing with family members that may be sick, or children that are stuck at home studying, or not able to do their sports, not able to do their physical activities, or keep themselves physically fit. The impacts of the pandemic have gone far beyond the health concerns of those infected or high-risk employees that are at risk of catching COVID. There's been an increase, as I said, in anxiety, stress, health problems, substance abuse, isolation. What can your business do to provide physical and mental health support to your workers during this time? Do you have wellness programs? Can you have a clinic or screenings or other things and to support your employees? Maybe bring in the health department or some nurse or some doctor or a health clinic to come and do screenings on blood pressure, on weight, on diabetes, on stress, anxiety. Are you encouraging exercise, maybe sports teams with your workers, or other types of exercise or yoga or some other physical fitness? Are you covering things regarding diet, stress reduction, the problems with substance abuse and alcohol? Are you encouraging employees to engage in self-care, offering services such as employee assistance programs? Some of those have anonymous hotlines. There's a lot of social media apps to help people that may have a substance abuse problem or an obesity problem or a diet problem or stress or anxiety. Ensure that you create a culture that makes people feel welcome and included. Do people feel that you're a good employer that cares about them? And that's really the image that you're trying to present. That way you will lose less employees. They will be more motivated to be more productive. The effort you put in here will impact your employer brand. You'll be known as a better company to work for, a retention and recruiting. What do you do with the people who aren't in the office now, that may be working remotely or may just be returning from working remotely? Don't assume you don't have to worry about COVID safety when it comes to remote teams. It's not really the case. In reality, COVID-19 has driven people to work away from the office, and it's resulted in new problems, new concerns. Just like you had to create protocols to ensure a healthy culture in your office, you have to do the same with your teams that have transitioned to remote. Keep those people who are not in the office in the loop with daily communication, regular participation, either on Zoom such as this, or phone calls, or emails, other types of things. Communicate COVID-related policies, other types of policies, worker support, the types of things you're doing to help people through these crises. Communicate with your remote teams regarding any type of assistance that they might need. Ask them to share their concerns. Keep them updated anytime COVID-19 impacts the workplace in any way. Remember that your response to all of this impacts their perception of workplace safety, whether or not it's safe for them to come back to work. It could eventually influence their willingness to return to the office when the time comes. Or if they're just going to go seek a job somewhere else, and you'll lose perhaps a valuable employee. Show empathy in dealing with your workers. That means look at it from their perspective. The saying is kind of, walk in their shoes and see what it's like. When someone moves from the office to work at home, it's easy to assume that they will face less stress and inconvenience than workers who continue to come into the office. It's true they may not have to commute and have some flexibility. However, they might have to make major adjustments, which aren't always easy to navigate. They might be sharing resources with their children who are learning remotely, or other spouses or other adults who also now are working at home or not working at all. Their technology may not be at the same level. Their computers, cell service, bandwidth, etc., may be reduced. Be aware that people deal with a range of complexities, and adapting will be something to deal with over the long term. Empathy will go a long way towards productivity and morale. In returning to work, think about workplace restrictions, scheduling. So some 41% of people currently working remotely say they need more than 1 week to prepare for a return to work. Among parents, more than half would need more than 1 week, and over a third would need more than 2 weeks. Some other management issues that come up. Follow your government's disease control, your local health department guidelines on addressing the pandemic regarding isolations, vaccinations, masking, and other protections. Communicate that to the employees, as we just said. The security of your data and business assets can become a problem with higher turnover, with disgruntled ex-employees. It's also a security issue with remote workers, which may not have the same cybersecurity that you have at the office. Talk with your security experts and your IT experts about how to protect your business or your organization. If your employees have returned to work, I know where we work, we've returned to work, we're back in the office. Don't ignore your employees' misery, their issues, their fears. Be aware that many workers are unhappy with their company's return to work policies. Rather than risk losing productive people, managers should confront employee dissatisfaction head on. As organizations eagerly reopen their doors more than a year after COVID pandemic began, many were surprised to watch their employees walk out for good. As I said, there's a huge number of vacancies, and it's getting very hard to fill. Companies have been quick to set up blanket policies that range from full return office to fully remote models, often to their employees' dismay. Having your employees' input, having discussions, having time to adjust, just ensures a higher employee morale and more productivity and less turnover in the long run. If nothing else, the pandemic has taught us that the one-size-fits-all approaches can be extremely counterproductive. So oftentimes those blanket rules, those rapid changes are really leaving a bad taste in your employees' mouths. Numerous surveys and news articles suggest that employees have been just as productive working remotely, even enabling their organizations to reach record profitability in many instances. So it begs the question, why are so many employers pushing so forcefully for all employees to return to the office, even as employee turnover across the industry is increasing? It may be because employers are feeling that without the employees present in their office, they're feeling the loss of control. How do we deal with this? Gibson and Wilson recommend a strong and simple approach to leaders and organizations trying to steady their workforces after 2 years of pandemics. They call it TAKE, and it means take control. It stands for, the T is take a strong stance. Employees don't want corporate platitudes and passive social activism. After living in the pandemic limbo for so long, as I said earlier, it has to be clear, it has to be fair, it has to be a strong stance. Alignment. Align your post-COVID employee policies, resources, and timelines like you would with any other business priority or client project. Keep your word and follow on your commitments. This point is most crucial. Employee trust is hard to regain once it's lost. And E, execute your organization's post-COVID workforce plan in a timely fashion and evaluate your progress constantly. Final steps to productivity. Manage employees with more agency, flexibility, communication, and listening. The communication is key in getting employee input, getting them buy-in, helping them plan some of your responses. Just helps with morale, with retention, with productivity. Embrace smart thinking using SMART objectives, which are specific, measurable, achievable, realistic, and time-bound, as you should with your other business objectives. So again, do appropriate planning rather than just rapid planning and allow things to fall into place, hopefully by themselves. Include or expand your employee assistance program to include healthcare, mental health, and substance abuse services. Consider workplace support such as daycare, exercise, sports, and educational programs. Finally, develop community programs that improve the image, the customer base. Everyone's been impacted by the COVID-19 pandemic. So better communities have better customers. Consider what your business can do to improve both its community and its bottom line. Any questions or comments?
Well, Ron, as far as I'm concerned, I'm impressed. I've never seen such a detailed and thorough presentation to address just about every possible point that anybody can think of or be interested in. I don't see any questions. And I think this is an issue that Harry is trying to resolve, because the students there may not have access to this yet, but at least we are taping this so they can preview it at a later time. But I don't see any questions right now. But again, congratulations, my friend. I'm impressed. It was very thorough.
Thank you. Yeah, I appreciate that. I left a few minutes. I was expecting about an hour or so, and I left a few minutes at the end. But you know, if they can feel free to maybe contact the organization and get me an email or something.
Absolutely.
And I'd be happy to respond.
Excellent. Excellent.
Okay, thank you very much.
Anytime, Ron. I appreciate your insightful educational information you gave us today. Very thorough, very nice. Thank you.
Thank you, Professor. That concludes my presentation.
Beautiful. Christopher?
Yes, John.
Ron, Professor, just finished. And I don't see any questions. I don't see anybody participating. So what do we do next? Say goodbye?
Say goodbye.
Okay. Thank you.
Thank you. Bye-bye.
Great job. Great job. Thank you. Okay, bye-bye.
Bye.
Off air.